if I have to answer it in one word, then the simple answer is no. So COVID-19 does not affect fertility in any way. Whatever evidence we have so far, it neither affects fertility, as in a spontaneous conception, or interferes with any of the fertility treatments, whether ovulation induction or even IVF. And therefore, there is no reason to restrict any fertility treatment or trying for a pregnancy on the basis of the pandemic, strictly speaking. Of course, when it comes to pregnancy, even though the vast majority of pregnant women will be fine, in fact, in the UK, so far, 2/3 of pregnant women actually do not have any symptoms of COVID, but some women, a small minority of women, particularly in the third trimester, which is the last 10-12 weeks of pregnancy, and in particular, women who have medical problems and high risk for complications with COVID, do suffer from some serious complication. But as I said before, that's a very small minority. So there is no strict medical reason to defer pregnancy or any fertility treatment for that matter because of COVID. With regards to vaccination, yes, at present, both the British Fertility Society in February 21 and the Royal College of Obstetricians and Gynaecologists in the UK are updating their websites about the recommendations with regards to fertility and vaccination. Vaccination in general will is quite well known to prevent COVID to a great extent, and thereby prevent any complications that might arise out of it, as I said before, in a small minority of cases of pregnancy. So at present, the consensus is that there is no evidence of any harm with any of the vaccines, and therefore anybody should not ideally defer vaccination if they're undergoing any fertility treatment or fertility investigations. And if somebody wants to defer it during the first 3 months of pregnancy, it's entirely voluntary, but at present there is no evidence to suggest any harm. In general, with regards to the vaccination program, in the UK, of course, we are having a very effective vaccination program so far. There is a little concern about the AstraZeneca or the Oxford vaccine about the risk of blood clots. The overall risk is actually very low. Till the end of April, about 22 million people in the UK has had their first dose of the vaccine, and almost 6 million has already had their second dose. And out of these, only about 242 people had some severe blood clots. Now, we know that in pregnancy, the risk of blood clots does increase. The percentage of people who had severe blood clot, therefore, will be about 11 per million people, so which is a very small minority. But having said that, in pregnancy, we know that the risk of blood clot does increase, and therefore, at present, the consensus is that if anybody is having vaccination while being pregnant, then if available, then the Pfizer or the Moderna vaccine is probably preferable, because over 100,000 women in the US data, pregnant woman has been vaccinated with the Pfizer or the Moderna there, and there has been no concerns about any complications. Also, while being pregnant, one can safely have the vaccine because the advantages, the benefits at this moment probably outweigh the risks. However, it's an entirely individual decision because there has been no studies published as yet on the safety of this vaccine in pregnancy. But from historical data, we do give non-live vaccine, as is any of the COVID vaccines, like whooping cough and flu in pregnancy, and they're very safe. And so far, there is no scientific reason why this vaccine should not be safe either. And as I said before, over 100,000 pregnant women in the US has received the vaccine, and there is no safety concerns as such. Infertility is obviously quite a vast subject, and there are many causes that can lead to fertility issues. In fact, nowadays we do not use the term infertility because infertility almost denotes that one cannot be pregnant. So we normally say subfertility, because for the simple reason that almost everything, every other cause of fertility problems, or most causes at least, could be treated nowadays with the various options available. There are many causes, as I said, about 25 to 30% of all fertility problems are due to the man. Yes, men don't get pregnant, but they're probably responsible for about 1/4, if not 1/3 of the problems. And therefore, a semen analysis and various other tests may need to be done. And if necessary, there are specialists, urologists who deal with male fertility problems called andrologists, who can look into it. And many of the aspects, particularly if it can be treated surgically, like somebody who has had a hernia surgery or has varicocele or various blockage of the ducts that carries sperm and semen to the penis. If they're blocked, then many of them can be unblocked. If they cannot be unblocked, then or repaired. If they cannot be unblocked or repaired, then sometimes sperm can be collected from where they are sort of held, and they cannot come out of the tubes. So they can be collected by, in most cases, simple day-case procedures. And in some cases, if it's due to some hormonal imbalance that is leading to the sperms not being produced, that also can be treated in many cases. So there can be treatment. If it's beyond that, so if there is a definite problem, a major problem with the sperm count or the sperm shape or structure, then IVF, and in many cases more specialist options like ICSI are available, and things are obviously improving every day. Another 25 to 30% of fertility problems are due to unknown factor. So that's could be chance factor, could be factors that we don't know as yet. But in most of these cases, assisted reproduction, IVF, gives a very good chance of conception. Another 25% would be due to ovulation problem in the woman. And the commonest cause for that is polycystic ovarian syndrome, but there are other causes that can cause this. An ovulation problem is one aspect that has undergone a huge transformation in a positive direction, where most of them can be treated either with very simple medications like clomiphene and letrozole, with certain surgical procedures like laparoscopic ovarian drilling. But if all this doesn't work, then with superovulation, as in an IVF cycle. But most of these can be treated. And lastly, about 10-15% could be due to a structural defect, which could be in the uterus, in the womb, could be a fibroid, polyp distorting the cavity, could be septum in the uterus, could be scarring in the uterus. It could be a tubal problem, maybe due to previous sterilization, or endometriosis, or sometimes cysts in the ovaries. And these all can be surgically treated. There are minimal access surgical options available where day-case procedures can be done by surgeons who deal with fertility issues, and in most cases can be treated quite effectively. So in general, as I said before, the current treatment, obviously it's a fast evolving stream and science, and treatment options are sort of expanding every so often. Yes, IVF or assisted reproduction as such has completely transformed over the last 10-15 years, and most cases of fertility issues can ultimately be solved through assisted reproduction in many cases if other means fail. But there are plenty of other means as well that can be effective, as I said before. In general, of course, one big factor that is important is age of the woman in this case. As I sometimes say, that nature has probably not been fair to women in many ways. One way is definitely with regards to fertility, and age. Woman's age is a very important factor, because it's not just the number of eggs that dwindle with age, but more importantly, the quality of the eggs that dwindle. And generally after 35, and definitely after 38 or 40 years of age, the quality of the eggs do matter, because the eggs, a woman is born with the finite number of eggs. Eggs are never produced in life again. So the eggs are almost as old as the woman herself. And therefore, of course, there are other avenues nowadays like egg freezing that is available. If somebody wants to is not thinking about a pregnancy now, but would possibly think about a pregnancy in the future, and age could be a factor, or some treatment that might affect the eggs, then that is an option. With regards to anything else, it's much more effective. IVF in particular was, one used to quote about 5 to 10, 15, 20% sort of 10, 15 years ago. Today, for an average 30-year-old healthy woman and a healthy couple for that matter, the success rate varies between 40 to 60% cycle. So things are definitely improving. And as I said, many other aspects of fertility, not just IVF, with modern surgical techniques and other avenues and embryological interventions in the laboratory are all improving the chances of conception in fertility problems dramatically. So with regards to having treatment for infertility, I completely agree with this question that is extremely important. In fact, nowadays we medicalize every aspect of life so much. And of course, we in the medical profession are to a great extent responsible for that. The very fact that pregnancy, fertility is a very natural, not just human, but a very nature of life. So in most cases, there should be, in most cases, it should be simple, general lifestyle factors that should be the first and mainstay, whether we are going for fertility treatment or not. As I said before, age is the single most important factor, age of the woman, and therefore that one needs, if one is planning or would plan a pregnancy in the future, that one needs to keep in mind, and there are various options available. But much more importantly, for a day-to-day point of view, a healthy lifestyle not only helps in all sorts of other general medical, physical, and mental well-being, it also helps fertility, whether from quality of sperm to helping ovulation. A normal healthy BMI for a woman between 19 and 24 is probably ideal for the hormones and for the eggs to mature and ovulation to take place normally. Similarly, avoiding smoking, which has a harmful deleterious effect on both the sperm and the egg, alcohol, drugs of recreation, and even caffeine in high doses. Of course, caffeine has a there are benefits and risks that can be discussed in details, but in general, high doses of caffeine can be harmful. There are other factors apart from exercise and diet. Too much exercise, however, is bad because that can alter the hormones and can prevent ovulation. But a moderately good exercise, healthy lifestyle is helpful. Having an ideal health condition before thinking about fertility or trying for fertility, like if somebody has diabetes, having an optimum control on diabetes is probably ideal, or any other health condition for that matter, thyroid problems in particular. Apart from this, of course, many occupations like for men, lorry drivers who drive for long distances or work near very high temperatures, because that can affect sperm count. Pesticide, working in pesticide areas, or areas where there are other harmful effects, harmful chemicals that one works with. So if one avoids, that definitely would help. So general lifestyle factors, and of course being aware of the fertile period, which is generally in a normal 28 to 30-day cycle, roughly about between day 8 and day 14 is the best time to try for a pregnancy, because just before ovulation, when the eggs are maturing and matured.